My name is Danser. I'm from Rotterdam in the Netherlands, and the study I have presented here today concerns a new type of antihypertensive treatment, and it's called an ARNI, which concerns not only blockade of the angiotensin receptor AR, but also blockade of an enzyme called NEP, neutral endopeptidase, NEP inhibition, so that's ARNI together. And the reason for this is that NEP is an enzyme which is involved in the degradation of an important group of vasoactive peptides, which we usually call natriuretic peptides, various subtypes. And they cause natriuresis, and they also are hypotensive. And so it might be a good idea to enhance the effects of these drugs, and which may indeed lower blood pressure. And since they are degraded by this enzyme NEP, blocking NEP would enhance the effects of these peptides. And so the idea would be combine it with an angiotensin receptor blocker, and you have even better effect, not only the effect of blocking the renin-angiotensin system, but now also enhancing the natriuretic peptide system. So that was tried in our study, which was performed in hypertensive rats, a genetic model which overexpresses mouse renin in the rat, which has angiotensin-dependent hypertension. And we did see that indeed in this model it's well known that an angiotensin receptor blocker had blood pressure lowering effects, but we simultaneously saw that now giving this ARNI, and so NEP inhibition on top of angiotensin receptor blockade, did have even better blood pressure lowering effects, and also we saw effects on cardiac hypertrophy, which was greatly reduced, much better than with the ARB alone when given the ARNI. And also we observed that we tried actually various doses of the NEP inhibitor, and there seemed to be some risk. At a certain stage it is improving the effect of the ARB, but you have to be a little bit careful here, because this NEP enzyme is an enzyme which is probably not only degrading these natriuretic peptides, but also other peptides, and among them is bradykinin, and this is a vasodilator peptide, so that might be beneficial. But one important other peptide is endothelin-1, and that's a constrictor peptide. So here we might have to be a little bit careful, because if we block the degradation of a constrictor peptide, that may not be beneficial. And indeed we saw that when you went up to very high doses of a NEP inhibitor, that indeed we saw that there were increased levels of endothelin, and in fact the enhanced blood pressure lowering effect of the NEP inhibitor disappeared when we used these high doses. So the message of the presentation is actually that NEP inhibition on top of angiotensin receptor blockade has potential and might be very beneficial, but that too much NEP blockade might be perhaps risky and increase, for instance, endothelin levels. And so we need further studies to sort out exactly what degree of blockade of NEP combined with ARB has the most beneficial effects in patients. And I can add also that at this stage there are already some clinical studies ongoing where a new type of drug, this ARNI, is already being tested and has shown indeed very high potential, not only with regard to blood pressure lowering, but also in patients with heart failure.